In this video, we will be discussing the joints of the thoracic cage. So our objectives for this video are to list the joints of the thorax and to describe the articular surfaces and ligaments of the costovertebral joints. And I have a special surprise for you. We have a special guest today who is going to be teaching you this video. So I hope that you enjoy and maybe you can guess who it is. So let's go.
Hello, everyone. This is Dr. J. Bay. Dr. Olson Long wanted me to go over the articulations with you, the joints here, since it is a nice recall from DAA, Bay. So thank you to you all, and thank you to Dr. Olson Long for having me. And so let's first discuss the rib articulations. And as we do that, we'll first discuss what they call the costovertebral joints. Now remember, the costovertebral joints can kind of be an umbrella term that includes the articulation between the head of a rib and the thoracic vertebrae, and can sometimes also include the costotransverse joint, which of course is the articulation between the tubercle of a rib with the transverse processes. Now remember, there are going to be costal facets or demifacets on the bodies of the vertebrae, and there are going to be transverse costal facets on the transverse processes. So if we discuss these articulations individually, if we focus on the joint of the head of the rib, now remember, this is a synovial joint. Now the heads of the first and lower three ribs will articulate only with the vertebral body of the numerically corresponding thoracic vertebra, meaning rib 1, the head of rib 1 is going to articulate with T1. And then the heads of the second through ninth ribs will articulate with the body of the numerically corresponding thoracic vertebra and the body of the vertebra above and intervening vertebral disc, so the IVD as well. So meaning rib 2 is going to articulate with T1 and T2 as well as the disc in between. Now if we focus on the costotransverse joint, it is also a synovial joint, and remember, that is the articulation between the tubercle of a rib and the transverse costal facet of the numerically corresponding thoracic vertebra. Now remember, ribs 11 and 12 do not have tubercles. Hence, T11 and T12 are not going to have transverse costal facets, so you wouldn't see those joints there. Now, if we discuss the ligaments, and I'll zoom in on this in just a second. If we discuss the ligaments involved here, the ligaments that are going to reinforce the articulation between the head of a rib and a thoracic vertebra, that articular capsule is reinforced anteriorly by the radiate ligament or the stellate ligament. You might remember that we called it during DAA. And then there is also an intra-articular ligament that connects the crest of the head of the rib to the intervertebral disc. So if we zoom in here, here is the radiate ligament of the head of the rib or the stellate ligament, and then they removed one of the articulations here so you could see that intra-articular ligament here. And of course this is out of Netter's. Then when it comes to the costotransverse joints, we have a costotransverse ligament which is going to pass from the posterior aspect of the neck of the rib to the anterior aspect of the corresponding transverse process. And we will also have a lateral costotransverse ligament which will pass from the tubercle rib to the tip of the corresponding transverse process, and a superior costotransverse ligament, which will pass from the upper border of the neck of the rib, or crest of the neck of the rib, to the transverse process superior to it. So you see here, again, getting out our laser, you see the lateral costotransverse ligament here, and then that superior costotransverse ligament here. And again, this image is out of Netter's. Now, we also know that on the superior aspect, so if we look at a superior view, we can then see the synovial cavities here, or joint cavities, of both the articulation between the head of a rib and the body of a thoracic vertebra, as well as the articular cavity or joint cavity between synovial cavities, between the the transverse costal facet on the transverse process of a vertebra with the tubercle of the rib. So I like this view, and you can kind of see the lateral costotransverse ligament here a little better, the costotransverse ligament proper there, and then the superior costotransverse ligament, which is cut in this ligament. So you kind of see all portions of that, or of those costotransverse ligaments, as well as those synovial cavities, because remember, these articulations are synovial, diarthrotic, freely movable, plane gliding joints, right? So we also want to discuss and remind ourselves of the sternocostal joints on the anterior aspect here, or sternochondral joints. These are the joints between the costal cartilages and the sternum, of course. Now remember, the first costal cartilage joins directly with the manubrium of the sternum. There is no cavity or cleft between them. Remember, that is a unique form of what we discussed in DAA. Remember, it was a unique form of a synarthrosis, because we cannot call this a synovial joint because it does not have all the criteria that makes it a synovial joint. We do not see a joint cavity there, rib 1 with the manubrium. But from the 2nd to 7th costal cartilages, usually these form small synovial joints with the sternum, so we can call them synovial, freely movable, diarthrotic joints. Small cavity with a cleft between the cartilage and the sternum, as well as the interchondral joints. Now remember, the interchondral joints are joints between the adjacent costal cartilages, mainly between 7th to the 10th costal cartilages. Sometimes they might vary that and say 8th through 10th, but 7th through 10th cartilages may involve also the 5th and 6th costal cartilages. So it could be, variable between references. And again, these are usually synovial joints, and they also contribute to the costal margin. So if we zoom in here on this image, again, you can see from the 2nd articulation down, we see the synovial cavities, right? So these sternocostal joints are going to have those synovial cavities, as well as your interchondral joints, which are here, which again, this fusion of these cartilages are going to help form your costal margins. All right, so thank you so much, everyone, and thank you again for having me, Dr. Olson Long. And remember, everybody, you are awesome.
So now, after listening to Dr. Ferguson, you should be able to list the joints of the thorax and to describe the articular surfaces and ligaments of the costovertebral joints.